This is it, the moment you and your teenager have been waiting for, the first semester of college. His classes are arranged, the dorm room supplies are packed, and you think you might manage to not cry when you drop him off on campus. Everything's ready. But did he remember to take care of a round of pre-college vaccinations? It's easy to forget something like vaccines, especially when you thought they were all taken care of in infancy. But with recent campus appearances of meningitis, a disease that causes inflammation of the membranes covering the brain and spinal cord, it's especially important to make sure those vaccinations are up to date before hitting the books.
When we're talking about the meningitis vaccine specifically, we're talking about a particular form of bacterial meningitis, which can be spread in epidemics, which is easily spread from person to person. And we used to think that this was a disease that really just affected the very young of us and the very old of us. But we know that this infection can definitely affect healthy individuals. And it was shown that there were some significant outbreaks on college campuses. And so the Centers for Disease Control and the Academy of Pediatrics started vaccinating individuals on their way to college, basically a pre-college vaccine that most colleges now at least recommend, if not require, is a meningitis vaccine to protect against this infection.
Children first receive this vaccine at around 1 to 2 years of age, but the next high-risk group is individuals between ages 16 through 21. So we want to vaccinate kids before they're high risk. The current strategy is to vaccinate all 6th graders, which will give them 10 years of protection that should last them through college graduation. Because college and early adulthood in general can be a hotbed for meningitis.
The biggest risk was when you first lived in the dorm, when you were first exposed to that big group setting, because this is an organism that can live quietly in the back of someone's nose or throat. But then again, with closer contact, sharing of facilities, certainly more intimate contact amongst peers, you can basically swap spit, swap saliva. As a result, you are now sharing someone's bacterial colonization. And so if you were somebody who didn't have exposure to meningitis, meningococcal bacteria, and now you're being exposed to it for the first time, it could actually cause infection in that newly exposed individual. And then that individual would produce a lot more of the bacteria and it would spread throughout the dorm or throughout a campus.
Early diagnosis and treatment is vital when it comes to meningitis. The earlier the treatment, the better the odds of recovery. An infection around the brain is not something you want to wait and see about. It's important to see a doctor immediately if you experience any of the symptoms, which can arise as early as 24 hours after infection.
Symptoms of meningitis are severe headache, often associated with neck stiffness, with photophobia, where lights severely irritate your eyes and cause pain. You can have pain throughout the entire body. Unfortunately, in some individuals, if they cannot localize or begin to fight off the infection, it can cause an overwhelming bloodborne infection that will be very quickly fatal.
Now, meningitis is not a very common disease, but given the potential severity of a meningococcal infection, we need to prevent infection from taking place at all. There are a few things students can do to protect themselves. Practice good hygiene, especially thorough hand washing. Don't share beverages with other people. And by far the best protection is the meningitis vaccine. And don't assume it can't happen to you.
Some parents are hesitant to think that their child's going to be at risk. These bacterial and/or viral illnesses attack at random. They do not select just weakened hosts. Healthy individuals, just due to normal human contact, can come in contact with these infections and therefore are susceptible. So parents are playing ostrich if they don't believe that their child is at risk. And unfortunately, with each of these, there is mortality or death potential involved. Although luckily bacterial meningitis is a rare illness, like I said, there can be a 10 or more % mortality rate and morbidity rate. The chance of having long-term complications and problems is upwards of 30% of individuals who get this infection. So certainly you wouldn't want your child to be playing Russian roulette with that type of an infection.
After college, the meningitis vaccine is still recommended if you're starting a career in an area that has continued exposure, like healthcare, or if you're in the military, or if you'll be traveling to what's called the meningitis belt, which runs through sub-Saharan Africa, through the Middle East, and into Asia. For everyone else, you probably won't be getting into the kind of hijinks that makes you susceptible to meningitis, but the vaccine does have boostability if you want to be extra safe. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.